You talk about doing extensive research in the book, and most people probably do Google and the disease or the ailment, right? But you really kind of dig a little bit deeper. What websites do you recommend people research when they're looking for, something about a diagnosis or a doctor or what have you?
There's so much information online, and so much of it can be really difficult. So you need to be very careful, particularly when it comes to healthcare, that you're going to credible sites and getting logically information that's neutral and objective and evidence-based. So there are some terrific websites. We've published them on our website, The Patient's Playbook, and they're in the book as well. I only have time to go through a couple of them, but we as Americans are incredibly generous people. We donate billions of dollars to healthcare philanthropies, and disease-specific philanthropies almost always have terrific information for patients. So if you're newly diagnosed with breast cancer, with an aortic valve problem, with diabetes, with Parkinson's, go online, identify the preeminent disease-specific philanthropy. What you'll find is they'll have education material for you, and many of them, like the Pancreatic Cancer Action Network and the Bladder Cancer Action Network, have people standing by, waiting for you to call because they're there, they're caring people, they've had experience with the disease, and they're there to help you.
Excellent. We're going to go back to the phones right now. We have Frank on the line from Baltimore County. Frank, what's your question?
Good evening.
Good evening.
The reason I'm calling is you talk about changing physicians, things of that nature. But my question is, how difficult is it to have your records transferred with you? I'm always reluctant to do so because I want to make sure that my long-standing decades of records do get transferred to the new physician.
Frank, that's a great question. Thank you for asking it. In fact, Leslie's going to share with us how he shows everyone his medical records.
Sure. Frank, good question. Those medical records are your property as a matter of law. Every bit as much as when you drop your car off at a parking lot or you bring in your suit to the dry cleaners, it is your property that the physicians have custody of. Yes. And they are obligated as a matter of law, upon your request, to send you all of your medical records. And it's a routine matter. People are worried, Yolanda, that they're going to offend their physicians if they ask for their medical records. Yeah. But you just tell them, listen, I travel a great deal. I'm seeing a bunch of different doctors. I think I'd like to have control of my medical information. I travel a lot, as we talked about. So I never leave home without my medical records. This little USB card that fits into my wallet has a little USB card here where I have all of my medical records on it. All one would need to do is put this into a computer and immediately comes up with a PDF that has my name, emergency contact information, the medications I'm on, my diagnoses, my allergies, nice, and my full medical history and access to all of that. So if the God forbid should happen, and I'd get hit by a car or faint or something, the EMTs know to go to your wallet to find out who you are. And if they go into my wallet, they'll find this, and it says, these are my medical records, and in case of emergency, call my company, Private Health Management, that answers the phone 24/7, 365.
That was a good plug for Private Health. So, but if I'm just the average Joe, I can put that on a thumb drive.
Absolutely.
Okay.
Anybody that knows how to download files from computers, and I'm a little old for that, and you might be as well, but people younger than us all know how to do it, and you can just buy a thumb drive for a couple of bucks.
Excellent.
And put it in your wallet.
Great.
It makes sense.
We're going to go back to the phones. We have Carolyn on the line from Baltimore County. Carolyn, do you have a question?
Yes, hello.
Hello,
doctor. About 20 years ago, I know it's a long time, but I had a hysterectomy. And when I woke up from it, it was a total one. I said, oh, what did you do to my back? And they said, we didn't do anything. Well, it turned into a big mess because they had to re-operate on me. They had stitched up a ureter, and it was a bad situation. Anyway, I have been left with the back problem for all those years. And I wondered, I've looked in the newspaper about these places that are called Spinal Institute in New York and Philadelphia. I did call them and sent my x-rays to them. They said they could cure me immediately. This is one of those things that takes they just do about an inch on you, and then you go home the next day and you're fine. And I don't know, it just sounded too good to be true. But I've tried so many things.
So you want to know if that's a good option for you?
Yes, I do.
Okay, Carolyn, thank you for the question. We appreciate it. So you hear about other alternatives for healthcare besides an institution. What are your thoughts on that?
So Carolyn, I'm so sorry to hear that you had a complication that should never happen with a procedure like that. And it sounds like you've been courageous dealing with pain and difficulty for a very long time. Kudos to you. What I'm worried about in what you said is it sounded like it was too good to be true. You see, I believe that human beings have terrific instincts about things. And we're all old enough to know when it sounds like it's too good to be true, it usually is. So I would encourage you to continue to engage your instinct as you're figuring out to provide how to get the right solution to your problem. And you're in Baltimore County, which means you can't be terribly far from the wonderful Johns Hopkins. I'd make a suggestion to you, which is go online on the Hopkins website, identify who the preeminent orthopedists who specialize in back problems are at Hopkins, and make an appointment and see what they think. You can't be too terribly far from that institution, and I think you can probably trust the caliber and the integrity and the experience at a place with a reputation like that.
Can't go wrong when you're dealing with Johns Hopkins. Medical errors. Let's talk a little bit about that, since that's sort of a little offshoot from what Carolyn was just saying. It's huge. I mean, it's the third leading cause of death after cancer and heart disease, which is pretty significant. How many medical errors are we talking about per year, and what can you do to avoid it? Because, she had the surgery, wasn't until after the fact.
Right. And as you and I talked about before, it's a huge problem. They're not just statistics, they're people. And it really alters and terminates people's lives way too early. We lose 400,000 people each and every year from preventable medical errors. That's the equivalent of 2 fully loaded jumbo jets crashing every single day of the year with no survivors. It is one of the biggest opportunities we have to improve our healthcare system, yet it's getting very little visibility from the policymakers and others. So my recommendation on that is I wrote an entire book to give people the guidance that they need in order to make sure that they don't become one of those statistics. One of the points I made in the book is the one that you were making earlier, the one I just made, which is if you have a significant medical issue, go to a significant medical center to see if you can get the proper care there.
Excellent.
Another is to make sure that your care is coordinated, that all of the physicians who are managing the different aspects of your health and your well-being know what one another are doing, so you don't run into the kinds of communication challenges that cause a lot of those problems.
Our time is going fast. I want to squeeze in another call here. We have Peretti from Harford County, or Perrette, forgive me if I butchered the name. Do you have a question?
Yes, hello.
Hello.
Yes, you were speaking earlier about that you have a legal right to have your medical records from a physician. What if they ask or tell you that you have to pay for them?
Great question. Thank you very much.
So each and every state has different regulations about the maximum amount that they can possibly charge you. And you can find out what those charges can be on a maximum level by going to a hospital's website, or some of the state health authorities have that on their website. And many of the doctors start to charge, but if you talk to them, if you've been a long-term patient, you can probably either dramatically reduce that charge or talk them out of it entirely.
Our time is going fast. We've only got a few minutes left. It can be difficult for some people to talk to their doctors, to even challenge their doctors if perhaps they think they're being misdiagnosed. How do you help them get through that? Because one of the things you said to me is that this book is important because it teaches you that you can do it. Right?
Absolutely. I believe that everyone can become a much more effective healthcare consumer just by following the steps and the guidance in the patient's playbook. But for people who are concerned, you see, we all hold our physicians in enormously high regard. And we put them on such an exalted stage that sometimes we deny them the opportunity of our participation in getting them the best medical care. So we could talk about how we can role play doing that.
Yes. Fortunately, our time is going fast. I want to get Grace from Calvert County in. Grace, do you have a question?
Yes, I do. This gentleman has referred a couple of times to being able to call up, if you get diagnosed with something, you can call up a specialist and make an appointment with them at no additional cost. But my question is that usually it's the insurance company that requires that you jump through certain hoops in order to be able to get that additional care. So in other words, they require that you get the permission from your primary care physician. So is it really that simple to just call up someone, a specialist?
Great question. Thank you. Is it that simple?
It's not necessarily simple, but I have to tell you it's extremely important. And it is unfortunate that many of the insurance companies still put in place difficult administrative barriers to people like you getting to see the physicians they should be seeing. So sadly, you have to invest a little time on the phone, on hold, working through the bureaucracy. But with the support of your primary care physician, you will succeed in doing it. So again, I'm not saying it's simple, but I am saying two other things. One, it's very important. And two, I know you can do it.
We've only got about a minute or so left. You said one of the things that you want, the takeaway is for this book, is that people should get this book before there's a problem. Talk to me about that.
Yeah, Yolanda, that's so right. You know, healthcare problems don't come by appointment. And it's so important for when that day comes, because it comes to all of us. When you're in the physician's office and the doctor says, you know, the lab results came back and it's not what we were hoping for. Mm-hmm. Or you're in the car and the car behind you doesn't hit the brakes. All those sorts of things. Then it's too late to figure out how to be prepared to make sure that you're getting yourself the best medical care. So this is a book that should be on everybody's nightstand.
Leslie Michelson, it was a pleasure to speak with you. Thank you so much for your time. The Patient's Playbook, we really appreciate your time this evening.